This is a case of 17 years old young man. 10 months ago, he started to complain of dull aching, rather severe abdominal pains, especially in the epigastric and left hypochondrial regions, with gradual progressive indigestion, dyspepsia, and vomiting. CT was done 1 month ago and revealed the presence of a soft tissue mass in between the duodenal wall and the head of the pancreas. This was the comment of the CT. In the last few days, he started to complain of significant vomiting, suggesting gastric outlet obstruction. So he was referred for endoscopic ultrasound to assess the duodenal wall and this soft tissue lesions in between the duodenal wall and the pancreas as described by triphasic abdominal CT scan. We are now scanning from the bulb of the duodenum, and we notice here that there is marked thickening of the duodenal wall. This is the muscularis propria, and this is the innermost three layers, mucosa, muscularis mucosa, and submucosa. There is marked thickening of the duodenal wall, and we notice here that there are at least two cysts in the duodenal wall. So there is marked thickening, maybe inflammation, edema, fibrosis, granulation tissue. And here this is a well-defined cystic area in the duodenum here, and this is the pancreatic head, and this is the markedly thickened wall, and this is a cyst, and this is another cyst with markedly thickened wall with considerable narrowing of the duodenum, especially in the second part of the duodenum. This is another cyst. So there are two cysts inside the wall with marked inflammatory edema. This raises the possibility of groove pancreatitis. So the diagnosis of groove pancreatitis is highly suggested. This is a young man with history of infrequent intake of alcohol. It is strongly suggested because there is significant narrowing in the duodenum, especially between the first and second parts of the duodenum. And US examination revealed marked thickening of the duodenal wall reaching up to 2 centimeters, which may reflect inflammatory edema, fibrosis, or granulation tissue. And there are two cystic areas inside the duodenal wall, so this may denote cystic dystrophy of the duodenum. So this is virtually the classic picture of groove pancreatitis, and unfortunately the management of groove pancreatitis may be major surgery like Whipple operation because there is significant luminal narrowing, but before that we can try sphincterotomy and cannulation of the minor papilla. But sometimes the patient may need major surgery, especially if there is marked narrowing of the duodenal wall due to marked inflammatory edema of the duodenal wall with granulation tissue and fibrosis.